Hey guys, welcome back to Therapy Thursdays. We are Fyzical. I'm Angela Yarborough and this is Dr. Jerry Yarborough. And today we're going to talk about dizziness and vertigo. So you remember when you were a kid and you would get on the playground and spin real fast on the merry-go-round? Or my favorite was I'd always sit in a swing and have my friend like twist me up tight. Did you do that?
Oh yeah, that was fun.
And let you go. And so then you'd get off and you'd be like walking around like drunk and just very disoriented, and it was fun back then. But now, not so much. That's not something we really want or look forward to in our older years, right?
Exactly. If y'all remember my story, I had viral meningitis and encephalitis, and I had no balance, very dizzy, so I couldn't even sit up or walk without assistance. So firsthand as a child, I remember those experiences, and then as an adult being sick. And it's extremely debilitating. And did you know that actually about 20% of the adults in the U.S. are affected by this every year?
Wow, I didn't know that.
That's crazy. So if you think about that, I mean, 20% don't sound too bad until you think about 1 in 5 people. And so you have possibly been affected by this as an adult or know someone who has been. And so the causes of dizziness and vertigo, which we'll be talking about today, dizziness and vertigo, the causes is because, I mean, it could be medication. So it's very important that you have those discussions with your pharmacist as to what medications could cause dizziness. It could be a cause from, even dehydration. Did you know that, like if you have like chronic diarrhea, that it could actually even kill you?
I've heard that.
Well, you're a nurse.
Yeah, I've heard
She's
that.
a nurse, so of course she knew that. But most people don't know that. You just think, oh, I got diarrhea, and you just kind of go on. But prolonged diarrhea can cause severe dehydration. And if you've never experienced it or know anyone that has, it can cause you to be completely out of your mind. You have no balance, and mobility is extremely difficult. Dizziness and vertigo can be caused from, orthostatic hypotension or blood pressure irregularities. It could be caused from, neurological conditions like MS, Parkinson's disease, having a stroke, or what we're really going to focus on today is it could be caused from benign paroxysmal positional vertigo, or better known as BPPV. So come back and we'll talk more about that in the next segment.
Hey friends, welcome back to Louisiana Living, Therapy Thursdays with Fyzical. I'm Angela Yarborough and this is Dr. Jerry Yarborough.
Hey guys, welcome back. So today we're talking about dizziness and vertigo. As we already talked about in the previous segment, some of the causes. Remember, it could be, from medication, it could be from dehydration, it could be from neurological conditions like MS, Parkinson's, strokes. It could be from blood pressure changes, diabetes, a number of things they could be caused from. But first, before we get into anything any deeper, I want to explain the difference between dizziness and vertigo. Because I get lots of patients come in, they say they got vertigo, but really they got dizziness. Or they say they got dizziness, but really they got vertigo. So really with dizziness, if you have dizziness, you have a sense of unsteadiness in your head, a lightheadedness, even a feeling of faint. You could be nauseated, and so those are kind of common symptoms of dizziness, okay? Dizziness could be short-lived. It could be long and persistent. Now, vertigo, there's really only one symptom with vertigo, and that is your environment is spinning. So whenever you turn your head too quick or you roll over, whatever the cause is, your room spins. You lose complete control. That's one of the scariest things. Remember, whenever I was sick in the hospital, I had vertigo, in addition to a lot of dizziness, but the vertigo is you have no control. Everything's moving, so you're very afraid. Many people will lose their balance. You can definitely get nauseated. But the thing with vertigo, depending on the cause, most of the time vertigo is very short-lived, associated with a movement. So whenever you move your head too quick and then everything is moving on you, or whenever you roll over in the bed and your room is spinning, you feel like you're in a dryer. That's a very good example of vertigo. Feeling like you're in a dryer and completely out of control. The good thing about vertigo is 97% of the time, the cause of it is benign paroxysmal positional vertigo, or better known as BPPV. And it's a condition of our inner ears. It's normally very easily treated, but you have to get to a therapist that knows how to treat it. And here at Fyzical, Ruston, Jonesboro, and now El Dorado, Arkansas, we are experts at treating this. So if you do, please don't delay. It's very debilitating and we can help you. Come back in the next segment and we'll talk about more treatment and things you can do at home to help. Welcome back, guys. I'm Dr. Jerry Yarborough with Physical Therapy and Balance Centers. And today we're talking about dizziness and vertigo, and specifically right now we're talking about benign paroxysmal positional vertigo, or better known as BPPV. Now what that is actually better known as crystals or rocks in your inner ear get loose, and they get into the canals in your inner ear, and they send the wrong signals to your brain, which send the wrong signals to your eyes, and your brains get all confused with the signal that they're getting. And whenever you move, you'll get an astigmatus in your eye, where your eye will move really quick, either kind of a rotation or side to side. And it's very easily tested, and we test that with a Dix-Hallpike maneuver. Now, my model here today is our Chief Financial Officer, Tara Howington, and she's going to be the model for us. So I'm going to show you how we do, you need to scoot back that way a little bit, how I perform a Dix-Hallpike maneuver, and what I'm looking for is your eye movement. So it's very important that you keep your eyes open the whole time. Straighten your legs out. Okay, you can hold my arm here. Okay, let me rotate your head this way and back, and we'll go down really quick, like this. Keep your eyes open, and I'm watching. Now, if her eyes were to be moving rapidly, either in a rotational, up and down, or side to side movement, I would know which canal that crystal was in. And from there, then I would do a certain maneuver. Typically, it's in the posterior canal, and we're gonna do an Epley maneuver for correction. So from here, I'm gonna turn your head that way, okay? And I'm constantly looking at her eyes. Okay, and then you're going to roll onto your side, keep your head looking over that shoulder, onto your side like that. Keep looking down over your shoulder, okay? And once she's okay there, then we're going to go ahead and set up, but keep looking over that shoulder the entire time, okay? And the therapist is always going to be real close, because you can get vertigo with each movement, which means you're going to be very insecure and no balance. Okay, once you're good here, then we look straight ahead. Okay, so that's one thing that we can do here in the clinic. Very easy treatment. You don't have to stay debilitated long if you just call your therapist and get treated. Now, some of the things that you'll need to do at home that can help is maybe sleep in a little elevated position. All right, you want to make sure that your movements are slow, because the vertigo is stimulated by quicker movements, so move slowly. And then you're going to want to make sure you stay very hydrated. You're going to want to cut back significantly on your caffeine and your sodium intake. So those are the few things you can do, but immediately call your therapist and get in for treatment. So thank you for joining us today, and we'll see you again next week.